Hi, I'm Nolene. I live in Darwin in the Northern Territory and I'm a mental health peer worker. I think it's fair to say that the changes to our environment and our lives as a result of COVID-19 have had a negative impact to the mental health and well-being for quite a lot of people in the community. This can be from obvious reasons like losing your job, perhaps working less hours, having a reduced income and experiencing financial pressure. But many times the reasons are less obvious and they can accumulate to impact our well-being. And these types of things or contributors include, big changes to the structure of our day, being less physically active, having significantly less incidental social interactions, perhaps this uncertainty about what's happening in the world, maybe a progressive increase in the volume of alcohol that you're drinking. If you're like me and have a history of mental illness, you may have had an awareness that all these changes to the environment from COVID-19 were likely to have a negative impact to your mental health and recovery journey. Or maybe this is the first time that you've ever experienced a mental health problem and the first time that you've noticed these sort of ongoing changes to your mood, thoughts, and potentially behaviour. Regardless, it's really important that you reach out and access some support, and your GP is a really good place to start, particularly if you don't have an existing relationship with another mental health provider like a psychiatrist or a psychologist. But it's also really important to remember that there are a whole range of factors that can have an impact for the negative on our mental health and well-being. So when we're implementing strategies that promote our mental health and well-being and support our recovery, we need to also look across the whole spectrum of domains of tools and strategies that we can implement to try and bolster how we're feeling and foster our recovery. And this is why it can be really valuable to connect with a non-clinically based mental health and recovery program. And the type of program that I'm currently involved with is a peer-led, group-based education and support program. And it's a great source of support for people who are either on their first journey into recovery after a mental health problem, or people who may have had experiences of mental illness over quite a long time. The particular program that I'm involved with is a 9-session program, and it's facilitated by peers who are people like myself who have their own lived experience of mental illness and recovery and have been trained to deliver the program and use our experiences in a way that's safe to support other people and promote their recovery. I really value the peer group environment because it is a safe and non-judgemental way to explore issues relating to your mental health and hear from other people who have first-hand experience implementing some of these strategies that support their mental health and well-being. The program that I'm involved with is being delivered as part of a pilot project in the Darwin region, and while the project had been put on hold due to COVID-19, we're about to recommence the delivery of this program. We currently have funding to deliver another 3 of these programs in the Darwin region, and they'll be recommencing from the middle of June. If you are a person that works and think that potentially you can't participate, please know that we are looking to schedule programs that are delivered outside of business hours. And I really encourage anyone who'd like to find out more about this opportunity to contact the Northern Territory Mental Health Coalition or go to our website. And on our website you'll find a whole range of information about the program, including the topics that are explored in the 9 sessions, some sample videos and sample material from the actual program itself, testimonials from local people who've already done the program, and a bit of an introduction to some of us who have lived experience of mental health challenges and have now been trained as local people to facilitate this program. Stay safe.